Hi, and welcome back to Recover360 Total Shoulder Health. In this video, I'm going to guide you through how to properly put on and take off your sling, also known as donning and doffing the sling. So whether you're getting dressed, icing your shoulder, or preparing for therapy, knowing how to safely remove and reapply your sling is essential. So today we're going to cover how to safely take off your sling, and then again how to put your sling back on correctly. We'll also talk about some key points to remember to avoid unnecessary strain. So let's get started. Some important reminders before you start. Before we go through the steps, here are a few key things to keep in mind. So moving your surgical arm as little as possible is essential. Your arm should remain relaxed at your side while removing and putting the sling back on. So do not reach, lift, or push with your surgical arm. Always support your arm. Use a table, a pillow, or your non-surgical hand to keep under your arm steady while taking the sling off. Stand or sit in a stable position. If you're sitting, make sure your back is supported. If you're standing, keep your feet shoulder width apart for stability. If possible, have someone help you with this. It's always easier if a caregiver or a family member assists, but don't worry, I'll also show you how to do it alone. So now let's go step by step. So first, how to safely take off your sling. So step one, find a supported surface, sit in a chair with armrests or stand next to a table or countertop. Place a pillow or folded towel on the surface to rest your arm on. Next, you're going to loosen the shoulder strap using your non-surgical hand. So gently unclip or loosen the strap that goes over your opposite shoulder. Let the strap fall to your side and don't rush through the step. Next, we want to remove the sling carefully. So slowly slide your non-surgical hand under your wrist to support your surgical arm. Gently pull the sling away while keeping your arm completely still. Let your arm rest on your lap, a pillow, or table. Lastly, we want to release the strap, if you have one, along your waist. If your sling has this waist strap, unclasp it carefully. Keep your surgical arm supported at all times. That's it. Now your sling is off. So how to put your sling back on. Let's go through the steps safely that'll help you put this arm back in the sling. 1, position the arm. So again, rest your surgical arm on a pillow or a table or your lap so it stays supported. Make sure your elbow is at 90-degree angle and your wrist stays in a neutral position. We're going to slide the sling under your arm using your non-surgical hand to gently lift the sling. So we're going to slide that hand in. Ensure your elbow is deep inside the sling pocket, not hanging out. Next, we're going to secure the waist strap again, if applicable. So here, we're going to clip the waist strap around your torso and fasten it. It should be snug, but not too tight. Next, we're going to attach the shoulder strap that we had undone before. So we're going to take the shoulder strap, bring it back around the arm, and then come back in and click it back into the sling. You want to make sure that your shoulder feels relaxed and not pulled forward while you're doing this. Next, we're going to make final adjustments to your elbow. It should be all the way back in the sling. Your hand and your wrist should be supported and not dangling over the edge. We're going to check for comfort, so making sure it's not too loose or not too tight. So now your sling's on correctly. So some key points to remember before we wrap up. We're going to go over some very quick reminders. So what you want to do is keep your elbow, again, deep inside the sling pocket for full support. You want to keep your wrist and hand inside the sling to prevent swelling. You want to make sure your shoulder strap is snug, but not too tight. You're going to use a table or a pillow to support your arm whenever possible. Again, what you should not do. Do not lift, push, or pull with your surgical arm. Do not let your elbow slip forward in the sling. Don't let your hand dangle outside the sling, and do not remove the sling too often, but only as instructed by your surgeon. Follow these steps, and it's going to help keep your shoulder protected and help promote a smooth recovery. So to summarize, always support your arm when taking off and putting on your sling. You want to move your surgical arm as little as possible and check the sling positioning daily for proper fit. Follow your surgeon's guidelines on sling use. If you have any questions, please reach out to your care team. Stay patient, stay consistent, and I'll see you in the next session.